We want to welcome to our studios here at Calabash TV, Sophia, who is the president of the St. Lucia Sickle Cell Association. Madam President, it's good to see you again.
Yes, thank you very much.
I think we spoke probably last year or year before.
Yes, last year.
Yeah, because last year was a COVID year.
Yes.
Most people have erased it last year. So, but it's good to speak with you. Again, Sickle Cell Day, World Sickle Cell Day is coming up on the 19th of June.
Yeah.
Can you bring us up to speed on this year's observances and celebrations?
Okay, for this year, we're looking at World Sickle Cell Day now. A few years ago, the United Nations, they adopted a resolution that was on the 22nd of December 2008, recognizing sickle cell as a public health problem. Okay, and so they're calling to raise awareness every 19th of June. In St. Lucia Sickle Cell Association, we raise awareness. We normally have educational programs with our members. We're looking forward to have educational programs, refresher course with nurses on island, the healthcare profession. And what we do in St. Lucia, we normally have a fundraising activity and church service, and we also distribute literature in health centers, schools, etc.
In conducting we'll get to the programs with the nurses in a while. In conducting your education activities, what is it that you find people need to know most about sickle cell disease?
I would say to know their status. Okay, so get tested to make sure that you're safe, because normally persons, when they think about having a partner, they don't think about that. But it's important to know your status. So in case your partner and both of you have the trait, that's a dangerous thing to have your partner and you with the trait, because there's a possibility that 1 out of 4 of your children may end up having full-blown sickle cell. So it's good to know your status.
In California, 1 in 450 African-American babies are born with sickle cell disease each year. And if not managed properly, people can die at an early age. It's a disease that affects mostly African-Americans, but anyone can be born with it.
We will be talking to Nurse Francillia Lubrin, who's a registered nurse and midwife and is also heading your education committee, in a little bit about some of the technical things, how to get tested and what's involved and so on. So we'll be speaking with her in just a little bit. But I wanted to continue on the education part of it. Talk to us about, I suppose there was also some record keeping in terms of the hospitals, babies being born.
Right.
Do they test them at this point to see or is that too early to do the testing?
At the hospitals in St. Lucia, every baby that is born, they must be tested. Okay? Normally they do the cord blood screening. And there was a talk about the heel prick. I think that was stopped. And I'm also now hearing of a new process, which I'm not too familiar with. But all babies being born at the hospitals, they do get tested for sickle cell disease, and the parents come after to get the results.
All right, so that's a source of information for you as well, and we'll be getting some more information from the nurse on that as well. So I suppose one of the key groups that you would certainly be interested in speaking with would be mothers or expectant mothers and so on.
Yes.
Yeah, because that is of critical importance for them to know what it is. So give us an idea of the kind of relationship you have with nurses and wellness centers around the island and so on.
Okay, well, since I came in, I try to go to the different health centers, go to the hospitals, and get information, especially since our database, we have persons, but the numbers, we no longer can reach them with these numbers. So it's like persons don't come in, So we go to the health centers, we give them the names of the people we have in the different districts to find out whether they can get in touch with these people for us. And we leave our numbers so these people can call us. So I have been going to the different health centers, and I also leave literature as well. Yeah. So
I suppose it would be key for those persons who you've interacted with in the past. They should occasionally be calling your office just to give updates and so on.
Yes, they should be coming maybe like, once every 6 months, or even if they're not sick. Some of them, they feel because they're not sick, they don't come to visit. But it's very important to be registered. So most persons we just see once a year, they come to renew their cards. Yeah.
Oh, what cards are these?
Registration cards. To be a member of the organization, you have to be already registered, and every year they pay $20.
Sickle cell disease affects the red blood cells, which transport oxygen from the lungs to all the tissues in the body. Rods of hemoglobin cause the cell to deform into a long, pointed sickle. These red blood cells are harder and stickier and no longer flow smoothly through the blood vessels.
When the blood sickles, it therefore cannot flow, gets stuck in the organs, all the organs, whether it's your lungs, whether it's your heart, whether it's, you know, that, you can imagine that's really debilitating. If people who are in sickle cell crisis, if they don't receive treatment soon enough, quick enough, it can unfortunately eventually lead to their death.
So talk to us about the kind of services that they can get from the association.
As of now, we don't have walk-in clinics because we do not have a doctor or a nurse at the organization. That is, we're working with the Ministry of Health to see if they can assist us in that regard. But when persons visit us, some of them come with their socioeconomic problems. You know, we have, for example, I can give a little basic counseling. You know. A little advice on how to take care of their bodies, how to take care of those who have the ulcers, how to take care of the ulcers. We give them literature. We help them with the basic medical materials that we have at the office. So, you know, as of now, we cannot really help them medical-wise. But we send our adults to Dr. Bird, who is willing and able to assist our adults. And our children, they normally go to the health centers where they see Dr. Ogden Lucy and the outreach clinics.
What kind of relationship do you have with the schools and so?
As of now, since COVID came about, we have not been able to go to the schools. Normally, we would write to our doctors, those who assist us, and they would go to the schools, especially the secondary schools, and give education programs. We're looking forward to having it probably next year, God willing.
I suppose COVID has affected everything, and so it must have impacted your own operations and so
Yes.
on. How have you been able to you know, overcome some of those challenges that COVID has thrown in terms of you as an organization and trying to get your awareness programs going and so on?
Okay, well, we do have 2 WhatsApp groups. That's how we disseminate information to our members. We have one WhatsApp group with our fundraising committee team, and another WhatsApp group with the members that we have, where you know, those numbers that we were able to get. So I have a group with them, and we let them know what's happening probably every month or so. Yes.
And give us an idea. You mentioned fundraising. You have an event coming up?
As of now, we have, for fundraising, we have our World Sickle Cell bands, red bands. You can donate $5. So we're going around getting donations. That's one of the fundraisers we have as of now.
Okay,
Yes.
and so people can get those, at least help spread
Yes.
the message as well. And as you mentioned, red is a color associated with sickle cell.
Although I was told it was burgundy.
Oh, burgundy.
But in the
Well,
beginning,
I'm
it's like, you know,
colorblind
we
a
have
bit.
red everything, but I'm told it was originally burgundy.
Okay, because I read online that it was actually red, but it could be red and burgundy, or a mix of the two. But certainly we want to encourage
Yes.
people to get the bands. So they're
Right.
supporting your
Yes.
efforts as well, but they're also helping to spread the
Oh yes, the awareness.
The awareness.
Yes.
And you have other activities?
Okay, we will be having a church service that's on Sunday at the Leclerc Catholic Church. It starts at 10 a.m. And some of our activities will be for this month, really, we didn't have anything planned, you know. Yes, but just our church service, the selling of our bands, and the distribution of literature, and visiting health centers. Yes, but next month, July, we will be having, like we did, I think, 2 years ago, we will be having an art program for members of the community and our sicklers that's interested. Yeah, and we will be doing a little bit of visitation, visiting our members that some of them, you know, not able to come to the association. Some of them have problems, hip problems, so we'll be visiting them.
Sometimes, difficult conversations are the most needed. Sickle cell disease has never been an easy conversation to have due to false information and misguided views. Conquering the Curve offers resources that takes the difficulty out of this conversation so that we all can increase sickle cell awareness together. Start the conversation with your family and friends. Visit conqueringthecurve.org to access the resources you need to start the conversation today.
I suppose as we come out of COVID, then your association will be able to get more active in the community as well.
Yes.
What kind of how do you plan your comeback after, well, we hope COVID will be gone soon?
Yes, we would like to have, like I said, a refresher course with some of our nurses. We would like to bring in some persons, resource persons for that. That's one of the things we would like to have. And we'll also like to have workshops. We have two of our members, myself and our secretary. We have been certified. We work in collaboration with the Ministry of Health. When it comes to managing chronic diseases, so that's one of the things we would like to have. Getting persons from the community or within the organization to have these workshops with them.
Excellent.
Yes.
Now, you mentioned literature and so on.
Yes.
Is there also an online presence or location where we can get some of the information in your Facebook page? Or?
As of now, we're working on our Facebook page and the website. So pretty soon we'll be launching that.
So we'll be able to get information online as well.
Right.
But generally, if persons want to know, they can just Google and get as much information as possible. All right. Anything else you need to tell us as we wrap up? Because we're getting to speak with Nurse Francillia Lubrin shortly.
I think that's it.
That's it. Okay. So just is there a number? Because I think you mentioned calling.
Oh yes, our number. Let me give you our information. All right. We're located directly at the back of the Leclerc Catholic Church. And our cell number is 485-2355. Our landline is 453-1011. Our office is open Monday, Tuesday, Wednesday, 9 to 2. Yeah.
But persons can call just either to make appointments, because we know with the COVID thing, there's all kind of protocols in place, or to get information if they notice something. All right. Well, Ms. Harry, we're pretty happy for your time, and we would certainly want to encourage St. Lucians to be more aware of sickle cell, and to obviously, like you say, ask questions, to learn more about it, and to help prevent, at least if we can keep the numbers down as much as possible. Thanks for your time, and we'll be chatting shortly with Nurse Francillia Lubrin.
Okay, you're welcome.
People with underlying health issues like sickle cell disease are at increased risk for severe illness from COVID-19. Protect yourself and your loved ones by wearing a mask and social distancing. Do your part, save lives.
We want to welcome to Calabash Studios here, as we said earlier, Nurse Francillia Lubrin, who's a registered nurse and a midwife, and also heading the education committee at the St. Lucia Sickle Cell Association. So, Nurse, first of all, how did you get involved with the education committee and get involved with sickle cell awareness?
Well, actually, my husband has a treat, and he has been from the time Sickle Cell Association, from the time when it was situated opposite Wet and Cool Express. I think that's where that optical place is there right now. He has been a member. And then he asked me to get involved, and that time Nurse Wilson, Sheila Wilson, it used to be at one time used to be with them. She asked me to get on board. He has the support. I don't have neither the treat, neither the disease.
So you've had direct experiences with somebody who has it. So what can you tell us about that experience?
Because nursing them, especially on the medical world, when they come with their painful crisis, which means all their whole body, their bones, and so I have been caring for them, seeing the experience they having when you see they are in painful crisis. It's very, very painful. You yourself sometimes feels the pain. Yeah.
And how, is there any relief? How can you help ease some of that pain?
Well, most of them, what is given at the hospital, they get morphine. They get pethidine, which give them a sense of relief.
So if somebody's at home having that episode, do you immediately have to bring them, or there are things you can do in the meantime to help soothe?
Yeah, there are things they can do. They can use hot pads to relieve the pain. Yeah. They need to drink plenty of water, because these people, they cannot afford to be dehydrated. Because imagine you, a sickler, when you dehydrated, their bones, because of friction in and all those things when you're moving. So they need to drink plenty of water. They need to exercise, because imagine you just stay in one place, but you still need to exercise.
But not strenuous exercise. But
not strenuous exercise. So these are some of the things they need to do. But if it's very, very painful, they must get health care.
So you have to take them to the hospital?
Yeah, you must take them to the hospital.
And how often do, based on I'm just trying to piggyback on the experience that you've had, how often will you find you get those episodes of pain?
Well, right now, as I'm not on the medical ward, I wouldn't know how they get right now, because right now I'm really on the obstetric ward.
I'm talking about just your personal experience of your husband having...
Yeah, but my husband, no.
Oh.
Because he's just a treat. He
just has the trait, so he doesn't actually have the disease at the moment. So explain to us the difference, having the sickle cell disease and having the trait.
Because the sickle cell disease, what the sickle cell disease is a genetic condition that is present at birth. And the sickle cell anemia it's a sickle cell anemia caused by a change in the genes that are involved in producing hemoglobin and iron-rich compound found in the red blood cells. Whereas the sickle cell trait is not a disease, but means that a person that inherited the sickle cell from one of the parents, they gets the trait too. Yeah. But now if both parents have the sickle cell trait, you will get 25%. That's 1 out of 4 would actually get the full sickle cell disease. Whereas 50% to every pregnancy, 50% will get the trait. So there are 4 children, 2 will have the trait and 2 don't have. They have 4 children, sometimes 1 will have the disease, and yeah.
Now, I know you wanted to focus a little bit on pregnancy and sickle cell. So talk to us a little bit about that. What somebody who's pregnant, or I suppose even thinking of having a child, what are the things that they need to start taking into consideration?
Yeah, first, the 2 partners must know their sickle cell status. So when they go to their health provider, they need to have what they call genetic counseling. So do the test so that they know. So if, for example, when they get the result, this one knows he has probably the father have the trait and the mother have the trait, or both have the disease, or they need to take genetic counseling. Yeah.
How easy is it to, is it just a simple blood test? How do you know?
It's through a blood test.
It's through a blood test.
Yes.
And is it a complicated?
So they can talk to their health provider, which will guide them. So now, when this person is planning to get pregnant, at the time they have to be closer to their obstetrician, their gynecologist, all these persons, so that when they are ready, that they can guide them into what they're going into. Yes, because sometimes you'll find if 2 parents not knowing what their sickle cell trait and having that child, you have that child, and let's say, for example, that child is full-blown sickle cell. Now that's where problems start, because you were not prepared for it. But if they are prepared for it, they will know, because the health provider will guide them and tell them what to do. So they'll be more prepared. Yeah.
Is it a simple test? Is it a test you can get the results immediately, or you have to wait a few days?
But it goes through a process. Yeah, it goes through a process.
So it won't be on the same spot. You won't get the results on the spot.
Yeah. And even when a child is born, we take the cord blood at the same time. As soon as the child is born, through the placenta cord, we take the cord blood and it's sent down to the lab. And the mother is asked to come back in 6 weeks for the results. During antenatal clinics, they send the mother for the electrohemoglobin test to get the results, or to know their status.
talk to us about the education committee and some of the things that you are doing.
Well, right now we have a committee in place, but right now because of COVID, the things we need to do to get into schools, go into the public places is like on a standby. But by next year we want to plan so that we can reach out to the schools, reach out to the public via media, via literature. Huh?
Mm-hmm.
Yeah.
So, Nurse, what is the most important message you want people to get now as you're here speaking with us and we are observing World Sickle Cell Day? What is the most important message that you want to get out today?
Well, the most important message I want to get out to the public, that you need to know your status, especially if you are ready to plan a family. Know your status, both mother and father, because it's easier for the mother when she go to antenatal clinic, then she is given the blood test to do. Then the fathers, if they don't come, so they have to, the fathers come along, get your know your status too. So if anything, that you don't get surprises.
Sometimes difficult conversations are the most needed. Sickle cell disease has never been an easy conversation to have due to false information and misguided views. Conquering the Curve offers resources that takes the difficulty out of this conversation so that we all can increase sickle cell awareness together. Start the conversation with your family and friends. Visit conqueringthecurve.org to access the resources you need to start the conversation today.
Anything else you need to tell us at this point?
And that as we are in the hurricane season, which the weather will be cold, that sicklers need to be very careful, keep warm, and also make sure that they drink plenty of water. If they are feeling pain, they can use the warm pads. They can have a warm hot water, in fact a hot water bottle. Don't put the water too hot that it will burn their skin. And if they are having the crisis is very painful, that they need to seek their healthcare provider. Don't just take medication. Yeah. Okay. And also in this COVID season, that they need to be being they acceptable to anything, they need to get vaccinated. Yeah.
Okay, so that's the advice as well, to get vaccinated to make sure that you're well protected against it. All right, and for persons who wanted additional information, the number you can call is 485-2355. It's also a WhatsApp number, so you can also probably send a message as well. And the landline is 453-1011. So you can call if you need to get some information or you need to even make an appointment to visit the office at La Clery.
And one thing, again, the pregnant, especially the pregnant women, if you know you have sickle cell, it's risk, you are at risk to have preterm, you can have a preterm birth, low birth, you can even have preeclampsia, which is a very high blood pressure. So that's why persons who they know they are sicklers and they are pregnant, make sure that they go routinely to their antenatal clinic, because they cannot stay without antenatal clinic, and make sure that they are also seeing an obstetrician because of those risks.
Certainly, and so we want persons, like we mentioned earlier, persons who are pregnant or thinking of starting a family, that you need to take this seriously. You need to have some conversations with the Sickle Cell Association, with your own medical, your doctor and so on, to make sure that you get all the information that you need as much as possible. Yeah.
And also, if those who are not pregnant, just persons in general, if they are experiencing anemia, decreased number of RBs, because these are signs of symptoms also of sickle cell disease. Swelling of hands and feet associated with pain. You would see irritability and fussiness in the babies, frequent infection, severe fatigue or tiredness, delayed noted growth in both children and adults, frequent episodes of pain, also known as crisis, in different parts of the body, and vision problems. So it's very important that they have to be hand in hand with a healthcare provider. Because I know there are some people, they don't like hospitals, they don't like health centers, but in this situation,
yeah, best you find out early than to have to deal with you know, some other situations that could affect your life and your lifestyle as well. Nurse Francillia Lubrin, we appreciate the time that you've given us. You are a registered nurse and also a midwife, and also you're heading the Education Committee at the Central Sickle Cell Association. I'm sure we'll speak with you again. All the best, and thanks for being here.
Yes, thank you.
People with underlying health issues like sickle cell disease are at increased risk for severe illness from COVID-19. Protect yourself and your loved ones by wearing a mask and social distancing. Do your part, save lives.
Sometimes difficult conversations are the most needed. Sickle cell disease has never been an easy conversation to have due to false information and misguided views. Conquering the Curve offers resources that takes the difficulty out of this conversation so that we all can increase sickle cell awareness together. Start the conversation with your family and friends. Visit conqueringthecurve.org to access the resources you need to start the conversation today.